December 2019, the first time world has heard the COVID-19 or coronavirus. And after 4 years, the topic is still relevant because new variants are coming to the world arena, and the human health and also the health of economy is suffering to various diseases spread by the new variants of the COVID-19. Hello everyone, welcome to the new series of Drishti IAS. I am Ritu and today's lecture is about COVID-19 new variant, which is JN.1, and this topic is important from GS3 perspective. Moving towards the points of discussion part. First of all, we are going to discuss the news, and then we are going to discuss that what is a brief introduction about JN.1, and then can it lead to a surge or more severe symptoms. So we'll have a nitties-gritties about this JN.1, what has led to the current concerns, do we need additional vaccine shots, or how to prevent this JN.1, and then practice question for prelims and mains. So moving towards the news part. So recently we have seen that in Kerala we have few cases of JN.1, and this has been also traveled to other states like Goa, Tamil Nadu, Karnataka, and what we have got the similarities that most of the cases have been got from the Singapore, because Singapore has witnessed around 56,000 of the cases in past 1 week. So because of that, this is a new matter of concern, and so many scientists and so many doctors are researching on this particular issue, that is it that dangerous what we have witnessed the other variants of the COVID-19. So that's why we have chosen this topic. Moving towards the next slide. Next slide is about what do we know about JN.1. So it is a sub-variant of COVID-19, we already know, and it can say that it is a descendant of the BA.2.86 variant, which is referred as a Pirola in a common sense. And the first cases of this COVID new variant has been found in United States, and since January, it means that since the beginning of this year, we are witnessing such kind of the cases in which people are suffering from this JN.1. So this is nothing new that JN.1 is new to us. It has been already in discussion since January, but in India it has erupted now. So that's why we are discussing this topic, and it contains only one additional mutation as compared to the Pirola, which contains 30 mutations. And why we are discussing about mutation? Because mutation reach to the human cells, and human cells receive the mutation, and because of that the virus spread to all over the body, and we spread disease to the other people also. So that's why mutation spike is very much important to discuss. So what we have seen that JN.1 consists only one additional mutation. On the other hand, Pirola consists 30 additional mutation. It means that Pirola is much dangerous than JN.1. Moving to the next slide. Next slide is about that can it lead to a surge or more severe symptoms. So what are the symptoms we are getting from this currently JN.1? So they have a similar symptoms like COVID-19 and what we have witnessed 3 to 4 years back, and sometimes we are getting the patient who are asymptomatic in nature, and mostly it is affecting the person who are the senior citizens. And this is the scenario of the JN.1 in India, but it varies to the other countries because they had received different kind of the vaccines and they had a different kind of immune system. But in case of India, it is mostly affecting the senior citizens. And when it comes to that, is it spread faster? So the scientists are still researching on this issue, and in that research, whatever we have got, that it is not spreading much faster what we are witnessing in the 3-4 years back. And in the second wave of COVID-19, we have witnessed that it spread so fast, but in this case, it is not spreading much fast. And we can say that in India, most of the population have got 2 times of vaccines, and most of the population are also exposed to the COVID-19, and because of these 2 factors, their body has get the immunity, and that immune system is helping Indians to cope up with this kind of JN.1 system. So this is that it is not much dangerous till now, and scientists has categorized this particular virus into the virus of concern, virus of interest, and another is that virus of concern. So virus of interest is a different thing and virus of concern is a different thing, because a virus of concern spread immediately, and it has a very huge impact on the human health. So it's on the priority basis of scientists that they need to search and they need to research more about that, how to prevent such kind of diseases. On the other hand, virus of interest is a matter of interest that the scientist wants and doctors wants to know about this particular virus, that how it can be transmitted to the other person, but it is not on the priority basis. So this is the difference between virus of concern and virus of interest. Moving to the next slide. Next slide is about what has led to the current concerns. So globally it is spreading, and we already have seen that United States and Singapore has witnessed a lot, and in terms of Singapore, it is witnessing 60,000 cases in a week, which is very huge in number, and it is reminding of COVID-19 second wave or first wave. So in that case, Singapore has to pay more attention towards it, and United States in also it is spreading, in Japan also it is spreading. So we need to be more cautious about this thing, and being a India country which whose diaspora living a lot in the Singapore, Japan, United States, they need to be very careful about when the people are migrating from here and there. They need to have a isolation program from all those people so that we can prevent on the first basis. What happened in COVID-19 first cases, that we had this prevention program and we started keeping people in isolation, but that was not taken on exact time or right time. So it's better to take precaution early so that we can prevent diseases in our country, and especially the country who are mostly affected from such diseases. So we need to drive this isolation program so that it could not spread like COVID first wave and second wave and third wave. So this is the thing. And if we'll get the data that has been updated on the global site, so what we have seen that it accounts nearly 70% of the total cases what we have witnessed earlier, and in case of United States it varies from 15 to 29%. So this is not severe till now, but if we will not take precaution, it can become severe. So this is the current concern, and we need to be very careful regarding this thing. And do you need additional shots? So we already had discussed that India has most of the Indian population has taken 2 shots, and many population has taken 3 vaccine shots. So in that case, they had developed immunity to fight with JN.1, and also we are the population, we are so much huge population. In that scenario, most of our population are exposed to the COVID-19 at least 2 or 3 times, and that antibody has spreaded in our body, and it has given the chance to fight with such kind of the virus. So in that sense, India does not need another kind of vaccine shot to fight with this kind of JN.1 problem, and we already had discussed that it is not transmitted as fast as what we had witnessed in COVID-19 second wave. So in that sense, we don't need any vaccine shots. We need extra precaution to take care of such problems. On the other hand, in other countries, it is spreading 1.6 times. So the people who have taken vaccines in countries like Singapore, there are more chances to getting 1.6 times to such kind of things. So it depends upon the immune system of that country and also the vaccine ingredients. So moving to the next slide. Next slide is about that how can you protect yourself. So we already have discussed that most of its patients and most of its sufferers are asymptomatic in nature, and it is mostly effective the senior citizen. So the government of India should take extra precaution regarding the senior citizens. We need to put guidelines, especially in the big cities where many people are migrating from one place to another place. So there should be an advisory regarding JN.1, and it's better to take precaution earlier so that we could not reach to that level that so many people are dying because of the oxygen and because of poor health system. So the health system should be also prepared. The hospital should know about such kind of the things, and there should be more awareness and precaution regarding this part. So that's why in that manner we can protect ourselves, and we need to sanitize our hands regularly. We need to take extra cleanliness precautionary measures. We need to be in a well ventilated space. So these are the common precautions we have taken, and what we have taken in COVID-19 first wave and second wave. So similar precaution we have to take in this scenario also, because the symptoms and everything are similar in nature. So moving to the next slide, which is the practice question for prelims, and your question is, which of the following statement is correct regarding the COVID-19 variant JN.1? JN.1 is a variant of concern associated with increased transmissibility. JN.1 has been identified as having reduced severity and lower transmission rates compared to the original strain. The JN.1 variant emerged in South America and has been primarily linked to the breakthrough infections in vaccinated individuals. The last option is JN.1 is a variant of interest currently being closely monitored by the global health authorities. So we already had discussed this virus of interest and variant of interest, or virus of concern or variant of concerns. So I think it's very easy to answer this question. Moving towards the mains part, which is discuss the impact of emerging COVID-19 variants on global public health, examine the challenges these variants poses to the ongoing management of the pandemic. So 4 years we had witnessed the pandemic and it was not vanished suddenly. We are still witnessing the socio-economic impacts of that pandemic. The most of the world economies are in the still recovery phase, and we are still preparing, and we are still involved in research and development of COVID-19. However, new variants keep coming regarding COVID-19, but what we have seen, that what we have witnessed 2 years back, it was not dangerous. So as a human being and being aware masses, we have become aware towards the COVID-19, and so many scientists, so many research and development teams are working regarding that, and we have earlier given precaution, and because of that we are not able to witness that kind of havoc which we had witnessed 2 or 3 years back. So in that sense, the human population and human generation has controlled COVID-19 and its variant a lot. On the other hand, what challenges we are getting, that we are still not able to find exact solution of such problems. So the research and development team, many scientists are working on that. So this is posing a severe challenge to the all the world economy, because if the economy is involved in taking care of the disease, so many financial problems occurred, so many social problem occurred, so many health issues occurred. So the government of every country need to be prepared more for such kind of the variant, and whatever the resources we have allocated for the other diseases, it is circulated and it got divided. So the attention from other diseases got divided because of the new variants of COVID-19. So it is appeal and request to all the world countries that they need to be very careful for such things, and they should not leave research and development, they should not leave any precautionary measure and health equipments related to the COVID-19. So that's it for today's lecture. If you have any queries related to this lecture, kindly ask in the comment section. Thank you.